It is hot today in Englewood, but I don't mind it because it pales in comparison to the heat our firefighters take on each and every day. I'm glad to be here with my friend, Congressman Bill Pascrell, who is passionate about the fire service and is one of the originators of some of the critical legislation that we promote and fight for in terms of the firefighter grants as well as the SAFER Act, and he is a tremendous champion. With Wayne Walk of the Firefighters Mutual Benevolent Association, George Helfich of the National Volunteer Fire Council, I appreciate and give a special thank to Chief Enerson and everyone with the Englewood Fire Department for hosting us today. We appreciate it, Chief. And to all of the different departments that are represented here from different parts of the state. When I look around at firefighters with us today, a lot of words come to mind. Courage, heroism, selflessness, and compassion. But there's another word that too often is associated with firefighters these days, and tragically, that word is cancer. We know that firefighters encounter more than smoke and flames when they run into burning buildings. In those embers are dangerous fumes, toxins, and known carcinogens that pose serious health risks. And according to the International Association of Firefighters, cancer is now the leading cause of death among firefighters. That's why back in 2016, working with Congressman Pascrell, I introduced the Firefighter Cancer Registry Act so we could better track the prevalence, the incidence, and the types of cancers among firefighters. And I'm proud to be here today to say 2 years later, after fighting for the bill, building bipartisan support for the bill, making the case for this bill, we are finally able to pass this bill through the House and the Senate and send the Firefighters Cancer Registry Act to the President's desk for his signature. And we expect him to sign it. Promises made, promises kept, because you have our back and we want to have your back at this critical time. Each and every day, our heroic and selfless firefighters save lives, and it's time that we help to save firefighters' lives. Once signed, the legislation will create a specialized National Cancer Registry, managed by the Centers for Disease Control and Prevention, to better collect and manage data on cases of cancer among firefighters. For doctors, researchers, and public health experts, we know that data is often the key to unlocking new discoveries. These discoveries can take many shapes, from the creation of better safety protocols and equipment to protect firefighters on the job, to the development of new treatments for the most common cancers that they face. It saddens me to know that former Haddon Heights Fire Chief Gene Dannenfelser, who joined me back in 2016 to unveil this bill in the midst of his own battle with cancer, has since passed away. But I know that Gene deeply cared about his fellow firefighters, and I pray that the National Firefighter Cancer Registry helps us prevent and ultimately develop better ways to protect the firefighters who risk so much to protect us each and every day. Of course, we know that our work doesn't end with the Firefighters Cancer Registry Act. We need to make sure our firefighters have access to quality, affordable health care, and that we don't have the administration take us back to when insurance companies could discriminate against patients with pre-existing conditions like past smoke inhalation. We need to protect federal investments in federally funded medical research and continue efforts to prevent, treat, and hopefully someday cure cancer. We need to make sure our fire departments are fully staffed and fully stocked with the equipment they need to meet the challenges of those who they seek to rescue as they go into harm's way. I'm sure Congressman Pascrell would agree that in today's environment, we can't take anything for granted, even when it comes to dealing with the challenges that our first responders have. I thought this bill was going to just immediately pass. We've never had partisan disagreements when it's come to firefighters. And I had to sit with the chairman of the Senate Health Committee, where this bill was lasting, and Senator Lamar Alexander of Tennessee. And I kept saying to him, why can't we move this legislation? Well, we have other registries. Well, okay, but we don't have a registry that deals specifically with the challenges that firefighters face in the environment that they run into each and every day. This is unique. So another registry on cancer doesn't help us understand the uniqueness of this particular challenge with these particular firefighters. Anyhow, I took him to breakfast, and I'm glad it worked out. That's why it's amazing what food can do, Chief. I understand.